Hello everyone, I am Nafim, currently studying in PSc in Prosthetics and Orthopedics first year, and today we will discuss about pathological gaits. To understand pathological gait, first we have to know about normal gait. Gait is the normal walking pattern for individuals. Generally, it explains how a person walks, which includes the walking speed, step and straight length, direction, angulation, etc. And any kind of variation from normal walking pattern is known as pathological gait. Mainly pathological gait occurs due to any kind of pathology or injury. First, we have the steppage gait. The gait is often associated with the foot drop, which means the person is unable to properly dorsiflex the foot due to the weakness in the muscles at the front of the leg. Steppage gait is typically caused by issues like peripheral neuropathy, peroneal nerve injury, or conditions affecting the lumbar 5 nerve root. The gait is best observed in the sagittal plane. It is most apparent in the swing phase of the gait as the individual has to lift the leg higher to avoid dragging the toes. Next is the foot slap gait, which is also known as inadequate dorsiflexion, which involves the foot making a slapping sound upon initial contact with the ground. Foot slap is caused by weakness in the ankle dorsiflexor muscles, commonly due to peripheral nerve damage or conditions like diabetes. It is also observed best in the sagittal plane, and this occurs in the loading response phase right after the heel strike. Moving on, we have Antalgic Gait. This one is characterized by shortened stance phase on the affected side to minimize pain. Causes can be anything that create pain with weight bearing, think arthritis, fractures, or soft tissue injuries. The sagittal plane works best to observe this gait, and it's mainly noticeable during the stance phase as the individual tries to avoid pain by spending less time on the affected leg. Then we have Calcaneal Gait. Calcaneal Gait occurs when there is an inability to push off due to weakness or absence of the calf muscles. This is often due to damage to the tibial nerve or condition affecting the Achilles tendon. Like the others, it best seen in the sagittal plane. It becomes apparent during the terminal stance phase when push-off is weak or absent. Scissor gait involves the leg crossing over each other with each step, often due to spasticity in the hip adductors. The gait pattern is common in conditions like cerebral palsy and spastic diplegia. Here, the frontal plane is ideal for observing the inward leg movement. You will notice this during the entire stance phase, especially as the legs cross midline. Next is Ataxic Gait, which looks unsteady or uncoordinated. This gait often involves a wide base and irregular steps. It is commonly seen in cerebellar dysfunction, multiple sclerosis, or sensory ataxia. The frontal plane is helpful to observe the wider stance and irregular movements. The entire gait cycle is affected with noticeable instability in both stance and swing phases. Propulsive gait is also known as fascinating gait. Involves the person leaning forward and taking short and quick steps. The gait is most commonly seen in Parkinson's disease and other basal ganglia disorders. Both the sagittal plane and the frontal plane offer usual perspectives to capture the forward lean and small steps. This is usually visible throughout the entire gait cycle as the person tries to maintain balance. Spastic gait is characterized by stiffness, and a lack of fluid motion, often with circumduction of the legs. It is common in conditions affecting the central nervous system like stroke, multiple sclerosis, or cerebral palsy. The sagittal plane helps observe this type of gait effectively. Noticeable during both stance and swing phases, especially the leg circumduction. With excessive foot rotation, we see an unusual degree of rotation of the foot outward or inward during walking. It can be caused by muscular imbalances, joint deformities, or compensatory movements for other gait abnormalities. The transverse plane is best for spotting this type of rotation. This is noticeable during the stance phase, particularly at initial contact. And lastly, we have neuropathic gait. This gait involves high stepping and often bilateral foot drop, creating a characteristic marching appearance. This can be caused by peripheral nerve diseases, diabetes, or condition like Charcot-Marie-Tooth disease. The sagittal plane is best to view the high stepping motion. It is most noticeable during the swing phase. And that wraps up our look at these common pathological gaits. Understanding this gait pattern is crucial for diagnosing underlying conditions and planning effective treatments. And that's all for today. If you found this video helpful, please give it a thumbs up. Thank you.